And she's got this tumor in the pancreas, right?
Wow. So what does the liver do?
Oh, the liver is a very important organ. Fatty liver is rising to be the main cause of liver cancer.
There's a link.
That's the link.
Okay.
Yes.
So fatty liver can cause
Liver cancer.
What is fatty liver?
Okay. One of the culprits of causing people having fatty liver is, and that itself is a risk factor for developing fatty liver.
Okay. So what are some tips here that you can tell our viewers here, right? Alright, so I just came back from Indonesia recently and I just learned about this island, this place called Timor Leste. And when I first heard the word Timor, I thought they were talking about Timun, Cucumber. Apparently Timor means east side in Bahasa. And so there's a place called Timor Leste. And today we have a doctor who spent 1 year of his life in Timor Leste to help the people out there. Is that right, Dr. Stephen Chang?
Hi, Joshua.
Yes.
You're right that I spent 1 year in Timor Leste, but Timor Leste is part of the island called Timor Island.
My goodness.
Yeah, and Timor Leste, if you translate to English, it actually means east. So it's in the eastern part of this island that is in the easternmost part of Indonesia. So it was used to be part of Indonesia after the Second World War, but it has since gone independent.
I see. So, in a way, if you put it in Chinese, it'll be called Timor Leste. Is that right?
Well, that's quite an interesting way of translating it.
So, do the people there speak Bahasa or another language?
So during those years when it was part of Indonesia, the population were so-called forced to learn Bahasa. But subsequent to their independence, they took up a national language of Portuguese because they were Portugal colonial before.
Okay.
But their native language is something called Tetun.
Tetun. Wow. So, when did they gain independence?
They got independence in about year 2000, I believe. Yeah.
Wow, you're very knowledgeable eh. Not only doctor, historian some more. And today, he'll be a comedian to make you all laugh. Steady, this one.
Let's hope so.
Very good. I like you, sir.
I like you too, Joshua.
But I'm not gay, But hey, welcome to the show. Welcome to Dr. Sewan Ho. And today we're so excited. So, doctor, what did you do in Timor Leste? Why did you go there? What was your purpose? I wouldn't go there for a holiday, I don't think so. But what do you do?
Actually, you can go there for a holiday. They've got very nice sea there. The sea is very nice, very beautiful. But be careful. Crocodile. There are crocodiles there. Now, back to your question.
Yes.
So in 2016, by a chance appointment, I met up with their prime minister then.
The prime minister of Timor Leste. So it was not part of Indonesia anymore, right?
At the time, they were not part of Indonesia.
So they had their own prime minister?
Yes.
Okay, sure, okay.
So the prime minister got to know me and then invited me to train their young surgeons and also to help out in their national general hospital in Dili, which is the capital of Timor Leste.
And so he bring you in?
Well, there was a contract to help bring me in.
So the prime minister of Timor Leste called you in and to help the people of Timor Leste?
Yeah, so I spent one year there doing some surgeries as much as I can do in that circumstances, but also to prepare the younger surgeons to take a small exam to equip them.
Wow, interesting. What was, is that a place that's under poverty or something? Or what is the condition like in the area?
Well, I believe it is still the youngest country in ASEAN for its definitely, but it probably also one of the youngest in the world. So in terms of economy, in terms of wealth, they are still very much below the poverty line. Yeah.
So means they are a bit more setback.
Yes. Yeah, because of years of war, the years of internal conflicts caused them to be a bit setback. Yeah, you are right.
Wow, so there's a lot of political instability there.
It's very interesting. Their politics is very interesting. There are many political parties. So when they go for election, sometimes it can be quite chaotic, and sometimes they have to form coalition to form a government, which adds to the complications in terms of running a country.
Right. I guess, we can talk about politics, but today we're here to talk about some medical matters.
Yes, let's go towards there.
And we love politics. You may be a politician one day.
No,
I'll vote for you. But anyways, So what was the worst medical condition that you observed or treated in Timor Leste? What's some of the worst?
Yeah, it's very interesting. I'm not sure why. But I remember when I first went there, there are patients who are very young. Only
Very
25 years old. I remember distinctly a young girl, 25 years
is
old.
very young.
Yes. And she's got this tumor in the pancreas, right?
Wow.
Which initially I thought it can't be cancerous because at 25 years old, we don't see that in Singapore, right?
Right.
But lo and behold, it turned out to be really a cancerous
Okay.
pancreatic
Okay,
lesion.
okay.
And there's another lady also 20 plus years old. And I was brought to see her. She's got a huge breast cancer that is already eating out of the skin.
Wow. You mean the cancer come out of the skin?
Yeah.
Wow.
So I'm not sure why they have such a florid, very bad cancers at such young age. So that was quite some of the very surprising, shocking experience when I first went there.
Are you also a breast surgeon?
I'm a general surgeon, so
okay.
I was trained to do many parts of the body. But my interest is now limited to the digestive area, especially the liver, pancreas, and the gallbladder.
I see. So was there any problems there with the liver that you saw?
Yes. So unfortunately, again, their liver cancers are all detected very late. They are very yellow and the jaundice, they are so yellow. And the tumors are so big, you can actually feel it through the abdomen.
You can feel the tumor.
Yes.
And it means it's a liver cancer?
It's a liver cancer. That means almost the whole liver is replaced by the liver cancer already.
Wow, interesting. All right, we'll come back and hit you up with more content. Stay tuned. So you saw the patient, right? The whole liver is distorted. Is it? Actually, what is the liver? Which part of the body is that? The liver.
So the liver in normal people is actually well protected by the ribs, mainly on the right side.
So it's covered by the ribs.
Underneath the ribs.
Below the ribs.
Yeah, extending somewhat to the center part. The left liver is somewhat to the center part, but most of the liver is on the right side. And
we have two liver or one liver?
It's actually one liver, but it can be divided into the right liver and the left liver.
Okay, fair enough. Right, so what does the liver do?
Oh, the liver is a very important organ. It helps to detoxify our blood. That means to clean up our blood from all the toxins. It is important in producing a lot of proteins, like your clotting factors.
Okay.
So if you have a cut, it clots. It's because your liver is functioning. It's producing clotting factors to stop the bleeding.
The wounds?
The wounds, yes. Yeah. So, and it's important in producing other proteins that's involved in the repair of the body. So any injury will require the liver to produce proteins to help to repair the body.
But you know when you talk about dialysis, that's for the kidney, right?
Yes.
It's not the liver.
A kidney is more of a filtering organ. It filters.
Okay.
A liver is a processing organ.
Wow.
Yeah. So not just to filter, but it processes all the things in the body that you don't want.
So it removes things that's excessive in the body.
Yes, excessive, poisonous. Yes.
So it's like the factory inside that kind of like cleanses the body and keep it clean.
Yes. It's such an important factory that the heat of the body is produced by the liver. Majority of the heat
of the body.
Yeah. When we keep our body at 36.9 degrees.
Yes.
Most of that is because our liver is functioning.
Oh, I thought it's because I'm hot.
It's not because you just drank some hot
definitely
water.
you're still hot.
Yeah. Oh, thank you.
Again, I'm not gay. But so the liver is very important.
The liver is very important. It's like powerhouse of the body.
So I heard this thing called fatty liver. Okay, we're not here to talk about liver cancer, but we're here to talk about fatty liver, right? It's a very common thing that we heard a lot. But I don't know what is fatty liver.
Absolutely right on both counts. Now we know in the world, especially in US, fatty liver is rising to be the main cause of liver cancer.
There's a link.
There's a link.
Okay.
Yes.
So fatty liver can cause
liver cancer.
Cause and effect.
Yes.
Yeah. Okay. Then, so what is fatty liver?
Okay. In simple layman terms,
yes, that's right.
A liver is made of many cells. It's like boxes. Okay. Now in fatty liver, each of these box or each of these cell is packed with fat globules.
There are a lot of fat globules inside, and then
so it replaces the content of the cells.
Okay.
So thereby, in some sicknesses, causes rupture or injury to the cells and give rise to liver hardening and, of course, subsequently liver cancer.
So fatty liver, right? So you say it can harden the liver.
Hardens the liver.
So makes the liver become unfunctional, dysfunctional?
Yes.
Or?
Eventually, it will lose its function.
Okay, so then what causes fatty liver?
So in simple layman, a lot of people will tell me that when fatty liver means they eat too much fat. In modern science now, we realize that it's part of this metabolic syndrome. And in fact, we found that one of the culprits of causing people having fatty liver is too much of high calorie foods or drinks. Okay, of course, the other group of fatty liver is related to alcohol drinking. Okay, but once a person is excluded from fatty liver due to alcohol, majority of the rest of people with fatty liver is due to metabolic syndrome, is due to lack of exercise, is due to high calorie food intake, sweet drinks, things like that.
Okay, let's assume that that there's no alcohol involved in this. I mean, we all know that alcohol, it has this liver effects, right? Liver damage, right? Let's put it out for a while. So if one guy, let's say call him James never consumes alcohol, right? Then if he eats high calorie food, like what kind of thing are you talking about? Like for example, now if you eat rice and you eat fish and you lift weights in the gym, sometimes you gotta have high calorie food, protein and stuff like that. Is that what you call it?
Protein is not high calorie. Yeah, protein is very low calorie. Okay. High calorie food is things that when you put in your mouth, it tastes sweet. For example, fruit juice that is sweet. There's a study that shows that when you drink fruit juice, especially those packaged juice without fiber, consistently, that is one of the risk factors for you to develop fatty liver.
Take note of that, everybody. So, but fresh fruit juice with no sugar is okay.
Okay,
pure
so
fruit juice with no sugar.
Fruits that are sweet in nature, they have this something called fructose, which is and that itself is a risk factor for developing fatty liver. So not too much fruit juice. And when you drink fruit juice, take it with the pulp. Don't just take the juice. The pulp. But pulp means, like, for example, the fiber part of the fruit.
Okay. So anything that is sweet, you put in your mouth. And then it can cause a high risk of fatty liver.
If you consistently do that, then it is a risk factor.
Okay, so what are some tips here that you can tell our viewers here, right? How to avoid fatty liver?
Okay, number one, choose the food that we eat. Okay, so moderate diet. Do not take anything that is too sweet, too much. Okay, and exercise. Exercise has been proven is very important to help to bring out, so-called use up the fat in the liver. Amen. And then to prevent the fat from just be dumped into the liver. Don't drink alcohol lah.
Sweet. So that is the idea. Fatty liver. Cool. So, fatty liver was a very interesting one. I believe everyone there also was much more knowledgeable about the fatty liver. But before we carry on, right, actually, we have not really known who you really are.
You didn't
yet.
ask.
Well, I didn't ask. But anyways, his name is Dr. Stephen Chang, and he's here to make a change. Yes?
Sounds good.
Vote for him.
I'm not running for election.
He's only running in our minds. So, 你是谁?
Associate professor in NUS still now.
Wow, you're a professor in NUS.
Yeah, and
it's interesting.
I'm the medical director of the Glad Clinic.
GLAD.
GLAD is spelled GLAD. It's a very interesting name that God gave me to name this clinic.
Interesting.
Yeah, because it means Gall Bladder, liver, and digestive, which is the area that my interest is in.
Whoa.
But more importantly, GLAD also stands for God loves and delivers.
Wow!
Yeah, because this is the motive, the motto of everyone who serves inside the Glad Clinic.
Wow!
We want God to show Himself among my patients, that He will deliver my patients from all their sicknesses.
Oh, you're very good, leh. Wow, I think you must become Prime Minister also.
No.
So that is your specialty.
Yes.
Gallbladder,
Liver,
and
and digestive.
digestive. Oh, so it's not pancreas. I thought it's
Okay, digestive is part of pancreas is part of the digestive system.
Very, very. Oh, so you are also, besides being a doctor, run your own clinic, you also have teach in NUS.
Yeah, currently my teaching commitment is more into the students who are doing research.
Okay.
And I also set questions. I also participate in selecting students to enter into NUS medicine.
Wow, really? Wow. You can select me or not?
I think your age, let me think about it.
Say Doctor not that leh. You're my friend now leh. You
But
must
it's
put me
quite
inside.
difficult to get into NUS medicine nowadays. Quite difficult.
Actually, just some tips for our viewers out there. What are some of the tips that you look out for when you pick students for NUS School of Medicine? To be honest, I did apply before as well.
Did you apply?
In 2016, after my A-levels.
I see. Obviously, you didn't get in.
Yes.
Well, yeah. So first of all, the first card.
I'm a lawyer now, so it's okay. So what are some tips that you can give to the
The
students?
first card, of course, you must have reasonably good results in your
Okay.
A-levels.
Okay.
Or an IB program. Yeah.
Does H3 matter?
You got to be as high as possible. Like,
Okay,
depends on the
okay.
whole cohort, right?
Okay,
Yeah,
okay.
As good as possible.
Okay.
Then after that, once you demonstrate yourself competent in your studies, we will select you for an interview where there are 5 stations, and then we will then test you on certain aspect of your character through the 5 stations. So you have got to do well in the interview.
I see. Wow, so now you all know who's the interviewer. So if you don't make it, you know who to look for. This guy is under my care now. You want to come in? You come after me first. Okay, see. So we know he is not just a doctor. He's also an entrepreneur. He has his own clinic, and he also teach in NUS. Wow, you're such an all-rounder doctor.
All-rounder.
Yes.
Maybe not as round as you. Yeah,
Wow! Hey! Oh, that's it. I'm kicking him out of Singapore. Okay, so right. So you talk about the second part, right? Like glad,
Yes.
right? Your first G is God,
Yes.
but also gallbladder.
That's right.
Now, when people like to say, my bladder is full, I need to use the washroom. So, what is that bladder that they're talking about, and what is the gallbladder?
Yeah. So the bladder, the urinary bladder is very different from the gallbladder.
Oh, different
Yeah. So the urinary bladder is down below. Okay, it stores urine.
楼下的嘛，
Yeah.
下面的下面。
Yeah. The gallbladder is here on the right side, just beneath the liver.
So it's like a small attachment.
Small attachment to the liver. Yeah, you may say so.
So it's attached to the liver.
Yeah, attached to the liver.
Oh, okay. Carry on.
Yeah. So a lot of people don't know that 10% of our population has gallstones.
Sorry, 10%?
10%.
Gallstones.
Gallstones.
Okay.
Yeah. And what is interesting about gallstones is that in the initial phases of gallstone disease, it causes symptoms like gastric pain.
Oh,
Yeah.
okay.
So one of my passion is to try to educate people that when you have gastric pain, don't just think that it's gastric pain, you know. Yeah, it can be because there are stones in the gallbladder. So I have many patients who have been popping in gastric medicine for many years, and the symptoms are persistently there, you know. And one fine day, when they do an ultrasound, they found gallstones. And after I removed the gallbladder and stones, their symptoms are
So
gone.
the first symptom is stomach pain,
Yes.
stomach ache.
Yeah.
I want the loud side kind of feeling.
No,
or
it's
different
not.
kind of
It's
pain.
more the gastric pain.
The-
or
the
upper, no, it's the upper part tummy. Upper part of tummy. Like
oh, the
you
upper.
went- yeah,
upper itu.
yeah, upper,
upper Serangoon.
Yeah.
upper part lah.
yeah, upper part of the tummy.
So they feel a lot of pain in the area.
They feel this discomfort.
Constant pain.
It can be a few kind of symptoms. Some people will say that it's like fullness. How come I eat only one chicken wing? Why so full already? Oh. Yeah, bloated. Yeah,
Bloated.
gas. Yeah.
I see.
Yeah, so they think it's gastric because the location is like in the stomach. Ma.
Then what caused that stones in the gallbladder?
We believe that most of the time is from our diet. When our diet is not healthy, is too excessive, you know, that's when there's a saturation of the contents of the gallbladder.
Saturation of the
Contents of the
At that point,
gallbladder.
I lost him already. I don't understand.
How does gallstones form?
Yeah.
Okay. Now, you must remember that the gallbladder stores the liquid that is pumped out by the liver.
Okay.
This liquid is so-called the processed liquid by the liver after it clears the blood.
Okay. Right. Okay.
So remember, the liver is to process the blood.
Yes.
So if the blood contains too much, for example, too much cholesterol, the liver will clear the cholesterol.
Cholesterol.
For example, cholesterol.
Okay.
Yeah.
Cholesterol.
So when the cholesterol goes into the gallbladder, if it's so saturated, so much cholesterol inside this liquid that is in the gallbladder, it will then crystallize out into stones.
And this one will hurt the gallbladder.
Yeah. So the stones will block the exit of the gallbladder, and that produces the symptom.
What are some tips to avoid these stones in the gallbladder?
Again, eat a very moderate diet, even nutrition. Do not eat in one meal certain food too much. No, not too much fried food at one meal, and so that the liver has an easy time to clean up the blood.
Oh, okay. Wow, that is a very simple tip. You should give it a shot. I mean, if you eat too much fried food, then you could be fried. So that's a very simple tip. So talking about that part, right? Then what is your treatment?
Interestingly, so what happened is traditionally, when we do gallbladder surgery, of course, in the old days we use a big cut, right? But traditionally, but nobody does that anymore. No. So for about 20, 30 years, we are doing keyhole surgery, which involves three small holes on the upper part of tummy and one hole in the belly button.
Okay.
But I noticed in about, 1 in 1,000 patients, they have got persistent pain in one of these holes. Because our nerves travels underneath the skin. And sometimes when we put in the hole, you injure that nerve. When the nerve injured, the pain stays for many, many years.
But it's 1 out of 1,000.
Yeah, about there.
Okay.
But because of that, I thought to myself, maybe I should limit the number of holes. So I started reducing the 4 holes to 3 holes and 2 holes.
Okay.
And then in 2008, there's this commercial company who came up with this device that can put a lot of instruments into one hole and play through the belly button.
Wow, okay.
So I became probably the first in the world to use the device, and I use it to take out gallbladders with scarless. Because, when God gave us an umbilical scar, it's a natural scar. So I used to tell my trainees,
have a scar?
Yeah, your umbilicus is a natural scar. Right? Everybody has a scar.
Can I see yours? So as in, so they go through the belly button hole.
I just go through the belly button hole.
Okay.
And when it heals naturally like an umbilicus. So I leave no scar.
On the patient?
On the patient.
So you go through that hole till today?
To today.
So to today, right now, this is your method of treatment?
For gallbladders, for appendix, some livers, and some pancreatic cancers.
And is it painless?
Well, definitely there will be pain, but less pain compared to multiple holes.
So you put the thing through, you take out the stones.
Through the same hole.
And then problem solved.
Yes.
But can you return back to the normal life right after treatment?
Of course.
So do they do any rest time or any, recovery time?
Sometimes some patients can even do it as a day case, just half an hour surgery and that's it.
Chop and chow. Then they're done and they're okay already.
Yeah, okay already.
Wow, steady, this one. Hey, power. But we'll come back with more tips made just for you. Doctor, what is Hep B?
Hepatitis B.
Ayo.
Yeah. It's still the main cause of liver cancer in Singapore.
Oh, really?
Yes.
Okay, tell us more about it, sir.
Yes. So I remember when I was a president or the founding president of the Liver Society in Singapore. Yeah. So I ran a nationwide screening for hepatitis B.
Okay.
For people who are more than 50 years old. And lo and behold, we had almost 4% of prevalence of hepatitis B in Singapore.
And they don't even know it.
They didn't even know it.
So it is like you can't even feel the virus in your body.
Yeah, you would not even know the virus is present in the body.
That is shocking.
That accounts for more than 65% of liver cancer in Singapore.
Okay. Tell us more. Okay, go on.
Unfortunately, this virus is so silent. It keeps destroying the liver, and it can cause liver failure. It can also cause liver cancer. Yes, but it can be controlled. There are medications to control it.
Where did the virus come from?
we believe that it's through vertical transmission, which is when the child is being born, there's mixing of blood with the mother. If the mother is a carrier, it can then pass on the virus to the child.
Wow, it's inherited on.
Not exactly inherited. We don't call it inherited because it's not in the genes.
Okay, but it doesn't mean that once you have Hep B, doesn't mean that you have liver cancer or liver problem straight away.
No. So a person who has hepatitis B in the liver,
Okay.
they are increased risk to the general population, but the risk is very different. It's almost like 200 times more at risk than the general population.
I see. So you mean Hep B stays in the liver?
Yes.
Okay.
Because it is something called a DNA virus. So it is imprinted into the DNA of the virus cells.
Okay, and so now we must check for Hep B.
Yes.
Right? So let's say the guy know that he or she has Hep B, and then what must he do next?
So, number one, if the Hep B virus is causing a lot of inflammation in the liver, destroying the liver,
Okay.
then we need to start treatment and to make sure that the virus stay inactive.
Okay.
And number two is that because hepatitis virus causes liver cancer,
Okay.
patients who have been infected with hepatitis B before,
Okay.
they need to go on every 6 monthly to a yearly ultrasound screen minimum to detect early occurrence of liver cancers.
So means they must go through first the check for Hep B first.
Yes, they must be diagnosed whether they are Hep B carriers. And once they're diagnosed, they should be on a program for regular screening.
And so we can look for you to check Hep B.
But no need to look for me. Many places also can check Hep B.
I see. See, I never heard of Hep B before.
Ayo.
I thought it's like HIV or something like that. It's not.
No lah. It's much more common than HIV in Singapore.
Then how to avoid Hep B one?
Uh-huh.
How to be happy, not Hep B?
Thankfully, in 1987, Singapore already implemented the nationwide immunization at birth. So our hepatitis B rates eventually will come down.
But I'm not born in Singapore.
Then you need to find out whether you had immunization when you were born. No?
But then what should I feel?
You won't feel anything. If you feel something, it's too late for you already.
Wow, that means I need to go for the jab.
You must. If you are not immunized, then you have to go for immunization.
Okay. Interesting. Everybody, take note. This is solid advice. Steady. Welcome back to Dr. Say One Hall. He say one, not I say one. But anyways, Dr. Stephen Chang, or maybe I should say Professor Stephen Chang. Good morning, sir. Can you have some tips here for our viewers to take home and tapao for themselves so that whenever they remember your tips, they remember Dr. Stephen Chang Say One Hall?
Yes, thank you for this opportunity. I just want to tell all my listeners, number one, screen your liver. Right? Screen your liver by excluding fatty liver. Screen your liver by excluding hepatitis B. That's very important because ultimately these two will destroy your liver and give rise to liver cancer. Very common in Singapore now. Number two, the gallbladder health. Sometimes it's not gastric pain. It can be gallstone. And now the treatment is so easy, so good, so scarless. Yeah, that is my take-home message.
Then the liver how?
Screen your liver, lor.
Oh,
yeah.
Wow.
Must screen your liver because you don't screen. It's asymptomatic. You don't have symptoms, so you must screen your liver.
Okay, solid. You see, you must listen carefully to the professor. I don't listen to my professor one. I still get A+. Anyways, everyone, that's all we have for you today.
Thank
high
you.
five first. High five.
Thank you, Joshua.
One time. He missed it. So remember to like, share, and subscribe because we've got more greater contents coming your way. So you better don't play and stay tuned. And doctor, we say it together and say it like you mean it. Dr. Say One Hall.